very excited today. I have really good news for you.
What's the good news?
Again, the mommy makeover for
All
$9,999.
right. That's right.
I think that John Kennedy was president, like when the prices of like were so low and the gasoline was so low and the mommy makeover was so low back in the days.
Back in the day.
You guys,
yeah.
come on! You're so lucky.
Now we did it again.
$9,999 again with Magic Surgeon and all the rest of the surgeons here. That's a bargain. What else does it include? Do we have a
Yeah.
stay included there? No.
We got the stay. It's not included in that one, but we have an amazing, stay for 7 days, 6 nights, care, massages, all that. It's about $2,000, and also in this particular case, includes the broker coverage,
Which is amazing.
which is
because
$500. So
guys,
actually-
listen, I came to Florida the first time in a hotel here. Impossible. The prices are outrageous. This is Fort Lauderdale, very touristic city, very near the beach. You do not find a hotel for less than $300. I'm not kidding you. You can Google it. It's insane. We charge you much less, and that includes 3 lymphatic massages, 30-hour assistance. Somebody is there with you all the time. You got a
Yep.
beautiful hotel. It has a breakfast for one, transportation included. I don't know what camera I'm looking, but I'm home looking good.
I know we have 3, 4 cameras.
We have a lot
now,
going on.
Right?
Transportation included, which is something that you don't want to worry after you wake up from surgery. And the doctor monitors your vital signs in his watch, and he does 1 hotel visit, correct?
Yeah, I know.
How
That's
lucky are you?
Yeah, that's pretty amazing.
Mommy makeover, 2 procedures of your choice, body procedures.
Yeah.
$9,999. Guys, you were asking me through DM, well, what if I get a BBL and just fat transfer to the face? Now, we don't want to say yes or no, because here's the deal. Since we want to be flexible, you have to send your online consultation and request what you want. And then the doctor evaluates the case with the coordinator. We send you an estimate, adjusting everything and trying to work with you. So you have any doubts? Send the online consultation. You don't know where the online consultation is? Don't worry. Send us a DM.
Yeah.
You can't find it
We'll
on
send you the
Instagram, Messenger, and Facebook. We're everywhere.
Yeah, we'll be here answering questions for you in regards to this special, but we're gonna be answering some questions.
But wait,
And-
before we go there, I have one more thing to say, and I'll let you. Listen, this is really cool. This is so cool that patients, every time I interview them, they want one of these, okay? You gotta earn it. I can't give it for free. Online store, topaesthetics.com.
Yeah,
At the
check it
corner,
out.
you're right. It says store. You click the link. We have this. We have this. Many more things. What we don't have is this for sale. This, you have to sign
Oh,
up for
you
the
got it.
special. $9,999, the mommy makeover.
That's right. So I see a lot of people joining from everywhere. I saw people from Colorado. We love to do this where the people start putting where they're from, so we can actually see where they're joining, which is usually all over the world. And then we're gonna be answering the questions. But let me tell you something before we go into answering questions. We have designed a system here at Top Aesthetics that it's not really available in many places, actually very few places, and none for this price, 100% guarantee. So we are gonna take care of you overall while you're here, okay? And we are not a recovery home, neither we recommend you to go to a recovery home because it's out of our control. We want to have everything under our control when you're recovering from our surgeries. And I can guarantee you that you will not have the same level of care that we will provide for you anywhere else for this price. So whenever you think, what we are doing now, thinking about what you're gonna be recovering, and with us, we had, for certain procedures and combinations, we had made this recovery that we offer mandatory for the perfect, just for safety, because our prices are already extremely low. And if you can have the same procedure, the same result with the same level of care for less than we will offer you this, including all these and the premium stay package and all that, feel free to go somewhere else. But I can guarantee you that we will not. 100%. So it is an amazing thing, and the prices that we charge are really extremely accessible.
Something else that I wanted to say that was very important. I was having a debate with one of our bosses here, his brother, Gabriel. You don't see him much, but he has a big role in this company. He does a lot of things that you do with technology. He creates it. So, hey, we bow to Gabriel Paladino. I know you're not listening, but You do a lot of stuff inside here. I was debating, I was saying, well, what about the patients that live in Florida? He said, look, Cecilia, I understand that you want to be considerate and empathetic, but if that patient goes through anything and anything happens and they're in their house, that is a big problem.
I don't care if you're my neighbor or
Exactly.
neighbor next door right here. If you're having a combination of procedures, like we do a lot of them, I'm gonna make you mandatory to stay with us. And this is just for your own safety because we have created a system that is like anything else. And we made it extremely accessible, especially when you combine the service that we offer, the safety levels, the results that we deliver. So, period, hands down, you know, like
it's that easy. And you
if
think it's just a surgery, whatever. Trust me, by all the testimonials that I post, and you guys see it, when you get up from surgery, when you wake up, it's like a train run over you. Not that you have any pain, but you've got stuff done, snatched and stretched and pulled and fat transfer. You need to rest and you need somebody to monitor you 24/7.
Yeah, absolutely. Well, you know, it's just that's why we created what we created. And that's enough said. So let's see. For all of those you guys there asking for prices, we're gonna do this very simple. You just send us your online consultation. We'll send you the price just for you, for your plan. Now, including the special at this moment. So, you know, so send us your free consultation. Mariela Magaña just had a BBL last July and she loves the results. I would like more round shape. Is that possible? Well, first, it would be great if you jump in a call here and you show the results and then we can tell you. A lot of times the roundness of your booty is very, very dependent on how much skin elasticity you have, so how stretchy your skin is. So it really depends on that. In part, it depends also on the amount of fat that you have. But we would love to see you. If you jump in a call and we can see you, will be great. Let's see if my Evans wants to talk to us. We're gonna bring it in here. Let's see. Do you take Care Credit? Yes, we do Care Credit, and actually you can check your own financing online with us. So, you know, if you're interested, go to our financing section in the website. You're gonna see it now, it's posted in the front. Just click the link and it will tell you, and you can actually see how much you wanna finance and it will calculate the payments for you. So it's pretty cool, topaesthetics.com. Can I add arm lift to my mommy makeover? Maybe. It's possible if you're not getting too many other procedures done. So make sure you DM us so we can take a look at your particular case. But yeah, it's possible. We have done, depending on, you know, what other procedures on the mommy makeover are you doing. If you are doing like 2 procedures, very likely it's possible. If you are doing 3 procedures, depends a lot on which 3 procedures you're having done. We keep all our surgeries down to 24 to 4 hours, pretty much. Nothing that goes over 4 hours. So if we can fit it in 4 hours, we'll do it. Gigi wants, no, here it is. Virgo wants to get another BBL. And she wants to bring some friends, I guess. Can I have surgery while on blood pressure medications? Of course, yes. As long as your blood pressure is under control, even if you are in medications, you should be able to with no problems. Can I book my surgery 7 or 8 months in advance, I believe? Yeah, so once you book the surgery with us, you have a full year, 12 months to have your surgery performed. So that's another good point that you guys bring up, because you just have to, like, to lock the price of the special, for example, you just have to put the $500 deposit down, and then you have a full year to get it completed. So you can pay part at the beginning and then finance the rest, however you want to do it, but you have a full year. We do surgeries in our surgery center right here in Fort Lauderdale. In this office, we have 4 operating rooms up in the 2nd floor. Let's see. Can you talk more about working out after BBL and tummy tuck? Can be a benefit, doesn't matter. I guess working out after BBL, definitely, you know, it's good. It's a great thing because you're gonna increase the volume of your booty on top of the increased volume by transferring fat, and that also is gonna keep things more, you know, I guess tighter or more plump. So I definitely recommend for you to do exercise after, you know, BBL, and especially if you have to lose weight. You know, besides having a good diet, exercise always helps. Let's see. Do you do, what else? How much does it cost
Let me
a
say
BBL?
something. They're asking if we can load, because we're in charge of the social media team, if we can load a full surgery in YouTube. You guys, unfortunately, because of restrictions of certain social media platforms, we can't load it, but we have Snapchat. Everything is live in Snapchat. God, I love Snapchat because you can put anything there and it's okay.
Well,
so like the surgeries you can put it,
surgeries,
right?
we don't have to cover as much. So
we don't have to cover as much. It's a Magic Surgeon. What were you going to say?
No, YouTube doesn't allow you to post a lot of stuff that is very, like, I guess, very visual in terms of surgery wise. They will ban it. They have already banned a few things that we have posted. So unfortunately, we can't load the full surgery. It'll be great.
We can't do it in the feed.
Maybe
in the stories of.
Maybe we open an OnlyFans.
Oh, wouldn't that be
Yeah,
great?
we'll open
OnlyFans,
our
I like that.
OnlyFans
OnlyFans.
just for surgeries.
Just for surgery.
We'll see.
So I answered your question right there.
Yeah. Hello, all the way from South Africa. That's awesome. So I saw we have people before they say from Colorado. Let's see. Okay, my husband keeps asking why he has to wait 6 weeks after surgery for sex. I don't know the reason. I only number if you know the explanation and give it. Yeah, so sex after surgery. We have a YouTube video for that, so you can actually check it out. But depending on the procedure that you have done, obviously sexual activity is considered more like exercise as well. So we always say, depending on the procedure you have done, it depends on when you can return back to exercise type of activity. A lot of times, certain things you can do after 2 weeks, certain things you can do after 4 weeks, certain things you can do after 6 or 8 weeks. But the most important thing is that you listen to your body and you behave and you do things in the limits of pain. So if it hurts, it's too early. Don't do it, because you might get some things undone or might create some problems. So that's the best advice that I can tell you. If you have like a BBL and lipo, usually after 2 or 3 weeks, you are pretty much clear to do things. But listen to your body and stay within the limits of pain. So 6 weeks post-op BBL and lipo, is it normal for now how long to have a burning heat in the belly and buttocks when I can go and when I can go to sauna? Yeah, it is normal to have that burning sensation in your skin 6 weeks, about 6 to 8 weeks after the procedure. And in order to go to a sauna, I always be mindful that the sauna causes a lot of vasodilation. And I would say probably about 3 to 4 months after to submit yourself to extreme heat like you will get in a sauna, to be on the safe side. And you can tell because you have 6 weeks, you're having this type of sensations, you're still recovering from it. Do you eliminate gynecomastia fat for men? It's for a friend. Yeah, absolutely. We just done a couple of cases this week or last week, and it was amazing, the results. Yeah, we do gynecomastia. It's a great combination is to do the gynecomastia to remove the gland, to do lipo of the chest and fat transfer to the pectoral area. So we do fat transfer on the top and then lipo the bottom and remove the gland if necessary. So yes, that's great combination for guys. What's my BMI limit? It depends on what. We have Top Aesthetics /BMI. You can check it out in the website, and then you learn everything about our BMI limits. But in general, for tummy tucks, nothing over 32. For lipo, nothing over 39. But it depends, depending on the fat distribution. I guess Christinelle is from Utah. Hi from Utah. I'm having a BBL, breast lift with implants, and tummy tuck. Will you guys show me how do I need to sit? Yes. So first of all, if you're having the procedures with us, we'll show you everything. You don't have to worry. You're gonna have, kind of your babysitters at the hotel. Your recovery assistants are gonna be teaching you and your companion everything you need to know, how to sit. They're gonna prepare your bed. They're gonna prepare everything so nothing gets really damaged or soiled. So we take care of a lot of things, pretty much every detail. So you don't have. This is why we created this system. It's extremely difficult to organize this. That's why nobody does it, or very few people do.
I want to add something else to that, because I know that this seems like something that is irrelevant, But you know how it is when you start, it's like when you buy a home. If you ever bought a home, they start to add things at the end and you're like, where the heck did this come from? Okay, not only that we include all this in the stay package, but you also get a bag with accessories. The garments, the faja, the creams, all of that, you guys, when you start adding everything up with this inflation, I'm sorry, mind you, it's $700. So it's like, it's a really good deal because you don't have to worry about anything.
That's right.
If you would have to take an Uber, if you would might have to buy the faja, if you would have to get the creams, if you would have to get, you add everything up and that adds up.
That's, yeah, exactly. So here we have thought in everything you need for your recovery. So take advantage of that and we'll take care of everything. Gigi says, good goodies.
Yes.
Yes, she knows about it.
She's always watching us. I
know.
love her.
Juan Ferrar is around here too. Had my surgery the last Thursday, and the ladies from Med Miami that helped after the surgery were awesome. So they were all staff at the stop. So it was all the staff. That's awesome. That's Tita JD05. If Tita wants to jump in here and tell us more about her experience, I know you're gonna help a lot of people that's watching. There's a lot of people joining now. That's awesome.
Yeah, that's awesome.
If you guys put there where you're from, it'll be nice. Message, waiting. Let's see, perfect. Okay, here we go. Can we have a cryotherapy on face after fat transfer? It depends. Yeah, you can. Obviously, you have to wait. I would say probably, wait a few months to do that. Let's see. Egypt Tree Loaded. She is from Atlanta, Indiana, New York. They say before South Africa, Colorado, the Bahamas. Too experienced. That's awesome. Let's see if Ivy wants to come in. Okay, we answer some. Hello.
Hi, we have the same hat.
Oh, look at that. That's
Let
a
me
beautiful
see.
hat.
Let me see that.
What's up, Ivy? How are
Did
you?
I give it to you or you bought it in the online store?
You did give it to me back in. I had surgery on January 26th.
That's awesome.
Oh, let me see. I remember you. Yeah, now I see your face. How are you?
I'm good.
You're going to show all your results to us? I'm curious.
So I still have my garments on because I wear them faithfully.
Okay.
So
Good for you.
I can show you. But let me see.
Please do. I'm curious.
I got a tummy tuck.
Oh, look at your waistline.
Wow.
pretty
Look at
amazing.
your
Guys,
waistline. Can we
I
turn
can
that
show you.
around?
I don't know. I'm gonna do it
Let's
like
do
this.
this.
I'm gonna do it like this. Oops, sorry. I'm gonna show everybody else. Let's see if we can see the. Yeah, you can see it right there.
Wow. Look at your waistline.
I'm a BBL, but I'm trying to see if I can get a. Give me a second here.
Yeah, put the phone down and you go back so we can see it. There.
You can
That's
see here.
much
I'm gonna go
better.
right here. Okay, awesome.
Wow.
Yeah, it looks great. This is at the top aesthetics.
Yeah. So I'm 9 weeks. But I
Good.
have a
Awesome.
question. 'Cause,
Yeah,
I feel really swollen in a tummy tuck, like in this area right here.
yeah.
It just doesn't go away. Like I know it's gonna take time, but I'm kind of like it's just not going down.
Okay, yeah, it's just because you are still too early. You're still too early. I would say you start seeing those areas improve a lot around 3 months or so. If you have any concerns about having fluid or something like that, we can always do like an ultrasound. If you come here, we can do it, but if not, we can send you an order to have an ultrasound just to make sure it's not a seroma or something like that. I imagine you don't have your drain anymore, right?
No, I don't, and I am getting the massages.
Okay,
I'm still
great,
getting
great.
The massages, but it's just swollen.
Yeah.
It feels.
When did you send the last set of pictures recently for the 6 weeks or not?
No, I haven't. Yet.
Okay, perfect. When you do that, if you're gonna get your email from us, just mention that in that email. We're gonna take a closer look, and we can always send you an order to get an ultrasound. Just to rule out and make sure it's not a seroma. But still, 6 weeks is very early. You know, so you had to wait another 6 weeks in order to start getting to the point that you lost most of your inflammation. So, yeah. Okay,
And
but yeah.
I also wanted to ask you, I got fat injected in my hip dips,
Mm-hmm.
and I'm wearing this new faja, which is kind of like tighter.
At this point, it's okay.
It's not compromising.
You will not. 6
Okay.
weeks after, you're okay. Yeah.
Okay.
Oh, that's good. Well, look at you. I mean, you look amazing. Your body shape is amazing.
Love the results. My boobs, I love everything.
That's
Thank you.
No, you're very welcome. That's awesome. That's what we want to hear. So thank you so much also for
Thank you.
tuning in and sharing, your results.
Okay, thank you.
We'll be waiting for next post-op coming soon.
Yes.
Alrighty.
Bye. Thank you.
Bye, Abby. See you soon.
All right, I have something to say to everybody. You're asking me, when is the special over? I'm going to do a t-shirt because every time you ask me the same thing. The special is over until you guys fund me for the BBL in my back, huh?
Pretty soon.
Listen, the slots are filling up pretty soon because the Mommy Makeover is a very popular, and it's a bargain actually. It's really cheap what we're charging. So it's filling up soon, the slots, and it's not going to last long. So what I would do, and I'm saying this again over and over in every live, lock the deal with $500 non-refundable that goes towards your surgery. Meaning you just lock the deal with $500 and
Yeah.
you lock that price because everything is going up, and you have a full year, let's say 11 months, to get the surgery done. If you want to finance it, I'm not going to get in that topic because I made a mess last Tuesday and I apologize. Just go to our website and it says, click on the finance option and it tells you how to go through that. You have Care Credit and Alpheon, so you can finance it.
Yeah.
But what I want to say is that I would lock the deal with $500 now, and then you can pay it further down the line. You have 11 months to book your surgery. You don't not have to worry about it. People are asking if they can jump into December to get the surgery. You can. It's not a problem. But if you want to catch this deal in particular, $500 to lock it. So
Yeah.
go for it, you guys, because the slots are being filled quickly.
Usually, these deals don't go for like longer than 2 weeks, and we're already kind of at the end of the first week. So, if I were you, I would really consider. You're not gonna get these type of prices, very frequently anyway.
What's
And
in the Mommy Makeover, they're asking?
Mommy makeovers are a combination of procedures, booty. Actually, Mommy makeover is the breast and tummy, but we also do the booty. So you can do booty and tummy. So the special is for 2 procedures for $9,999. And then you can add a third procedure for 50% off that. So for about $13,000, you can have 3 procedures done. For $10,000, you can have pretty much 2, which covers the breast and tummy, or the breast and booty, or the booty and tummy, or any combination of that. So remember this. This is an amazing deal, And then we also offer this recovery package and the full week here at the hotel and all that. That it makes it extremely safe for an amazing price too. Is it safe 6 weeks to sleep on my butt after BBL? Yeah, after 6 weeks is absolutely perfectly safe. So Pretty Brunette 86. Hi doctor, how you decide to place the breast implant under the muscle or over on top of the muscle? What is the difference? So usually we like to put it underneath the muscle because it's the safest approach for the breast implants. Now some patients that have a little bit of droopiness or ptosis and they have pretty thick tissues, we could put them to make it look a little more natural and better. We can put it on top of the muscles, but in general, I will always advise to put it under the muscle. Okay, let's see. Have a lot more questions. What if I'm on my period? Well, it doesn't matter. 50% of the patients that we do surgery on are on their period anyway, so don't worry about it. Can I have how soon after a vaginal delivery can I get the surgery? We would recommend for you to wait about 3 to 4 months after a delivery. If you're having a C-section, then it's probably better to wait about 6 months if you're having, for let's say, a tummy tuck. But it's a good question. After the vaginal delivery, I will say wait, because you need all those changes from pregnancy to go back to kind of normal. And if you are breastfeeding, you're gonna have to wait until you finish breastfeeding. And I would say wait about 2 to 4 months at minimum of 2 months after you stop breastfeeding if you're considering breast surgery. So, those are really good recommendations. I think it's a great question. If there's a difference between, vaginal delivery or C-sections in terms of whatever you're gonna have done. So thinking about 3 to 4 months after vaginal delivery, as long as you're not breastfeeding. Can I have, is it what is more, okay, here. How soon does J Plasma help with cellulite as well? J Plasma will tighten your skin. It's not designed for cellulite, and we don't do it in areas, but if we are doing J Plasma on your thighs after lipo, it will help a bit. But again, remember, it's not the treatment for that. What is the recommended time to use a BBL pillow? We recommend 3 weeks. Let's see. Is there a 360 BBL special and or a roundabout price? Okay, send us your consultation and we'll send you what do we have the specials for that, in terms of BBLs, 360 lipo, J Plasma, and so forth. I would like to speak about my surgery. I'm out of state, and also how I prepare when I get home. I live in a small town. Yeah, you're welcome to jump in a call here. We can answer your questions, or DM us, and we're happy to jump in. We can answer all your questions. 90% of our patients are not from here, so we are very used to having patients. Hello. Look at you. How are you?
I'm sorry.
That's okay.
How are you?
Pretty good.
I just had my procedure with you a week ago. I did the breast, tummy tuck, and the BBL.
Well, hello, Missy.
How are you guys?
Listen, nothing counts if you're not showing it on the camera because we need to see how it looks.
Hold on, let me see.
That's how it works, baby. Come on. She's so cute.
How you feeling?
Go ahead, show me.
Wow, that's pretty amazing.
Wow.
So I'm a week and a half out,
That's nothing good.
That's awesome.
so I'm still a little hunched over.
Of course. Do you have your
But
drain?
I feel good. I really
Good.
feel. I feel good.
Awesome.
Turn it back.
That's great.
Yeah, I feel pretty good. I had the Exparol.
Good. Do you recommend it?
I highly recommend it.
Good.
I didn't really feel too much discomfort, or just discomfort, a little bit of soreness, not really pain.
Awesome. How was your recovery here at the hotel?
The hotel was great. The ladies that came to help were so awesome. They helped me with positioning in the bed, how to put the pillows on, I felt comfortable. It was awesome. I loved it. And then the ladies that came for the massages,
Mm-hmm.
also, they were so sweet.
No, that's great.
They took super good care of me. I could not have and had any better care.
That's awesome. Hey, and how, what patients were asking and were worried about traveling back home, if they live out of town. How was that experience for you?
I live in Tampa.
Yeah.
So my flight was relatively short.
Right.
Like I said, just a little bit of soreness and discomfort of just being the whole process of being in the airport. But other than that, it was quick.
Awesome.
Not too much, not pain, just a little discomfort. And it was fine. Once I got home, I was fine.
And you're 1 week, 1 week ago, and you already looks like you're doing great. I mean,
Thank you.
it's hard to recover from these procedures. It's not easy. So
No, it's a process, and
Yeah.
that's what you have to mentally prepare yourself for.
right, but
I'm so excited! I can't wait to see the final results.
well, in about another week, you're gonna have to be sending more pictures, because at 2 weeks we'll ask you the first, set of pictures. Once.
Yes. I have to take them. Thursday will be my second week.
That's awesome.
This
That's awesome.
Thursday, so I will be sending you more pictures.
Thank you for tuning in, and for let us know how was your experience, and you're recovering phenomenally. Thank you so much.
Yes, thank you, Dr. Palladino.
We'll stay in touch. Stay in touch. So here we
Okay, wait, can I answer one more question? I'm sorry.
sure. Not
Okay.
says he wants to continue to answer questions.
I'm sorry because I apologize. This is the last time. No, because
Don't
I
lie.
know, because I interview you guys in the morning and after when you go to the hotel, and you are saying something very important. And I feel I'm a very empathetic person. You're saying, what about the ladies that are scared about getting surgery? It is a pity that you didn't see the live of last Tuesday, because there was a girl here that came to get surgery. She was crying like she didn't even want to get inside of the room. She was scared of a needle, okay? Which a lot of you guys are, you go through that. Some of you guys are scared of the surgery. Some of you guys are scared to die. Listen, there's a risk in everything. You go on a bike ride, you can get hit. You cross the street, a crazy man can come, they can hit you. Anything you do in this life, you have a risk, okay? But the good news is this, numbers don't lie. Dr. Palladino has operated 8,000 plus women. That is a lot of people, and man, I'm sorry.
Yeah.
That is a lot of people.
And I tell you, like, there is something that we put a lot of emphasis in your safety here, and we take a lot of precautions, much more extra precautions that people even take in hospitals sometimes. So we created this environment just to make sure that everything goes as safe as possible. And I know that most patients are scared because who wouldn't having to go through surgery? I think women are really courageous, more
You're
than
saying I
men.
read a lot of crap online, and that's why I'm scared.
Yeah, exactly. But you will hear a lot of things, like if you go to YouTube and you're gonna see. But in our practice, we created the safest environment. So there's no way. I mean, it would be very difficult for something happen. And we are very mindful about this. We have a very thorough preoperative process to make sure you're suited for surgery, and we put all the investment into the surgery portion as well, giving you the best drugs possible with the best people taking care of you, all the way from the anesthesiologist. Obviously everybody in the team here is aware. They're very well prepared. They're pretty much overqualified a lot of times. And then post-op, we also take care of you, which this is not very common. Not very many practices take care of you post-op. We do, because we believe is the right thing to do. And we are, in this case, above the standard of care. So I tell you, I think this should be the standard of care, but it's very hard to manage and organize that, and that's why they don't do it. We do it. So when you are considering surgery, pay attention to these things, because these are the things that make the difference. When you have to figure out everything on your own, it's not easy, okay? All the recovery stuff, all these, accessories that you need, all these, even management right after surgery is very, very difficult. And we had it all, just done for you. And you will not find it for, the price that we do it here. And so all those things to keep in mind when you're considering plastic surgery. I can make a list of everything that we do, but it's pretty amazing, and the risk with us is minimum. How long did it take for you to stand up straight after tummy tuck? It depends. Some patients actually stand up pretty quickly, within a day or two. Some other patients may take a little bit longer, may take all the way to a week, sometimes 2 weeks, but usually not longer than that. That's because of your muscle repair and your skin excision. It depends on how much skin you have removed and how tight your muscles and your tissues elasticity. How do you sit in your flight after a BBL? Well, we'll provide you with a BBL pillow that you can use in the seat, and you just put it in the seat and then sit. That's just gonna offload your booty, so you don't squish it while you travel on the plane. Any dates available in December? Yes, I believe there should be by now, but remember, December is a very popular time that people request surgeries for. So definitely, if you want to book for December, book soon. And remember that a lot of times we're closed at least, a week or 10 days in December. So that makes it for a shorter month. How long after incisions are fully closed you can submerge yourself? So I will always say submerging yourself in water, assuming everything's sealed, should not happen before 6 weeks, just to make sure that everything is well healed and sealed. Okay, 6 weeks. And that's considering you have everything healing fine. How bad is a tummy tuck compared to a C-section? Okay, by patient's experience, they always say that is very, very comparable. Some patients had more pain actually with the C-sections than the tummy tucks, and some patients are the reverse. Obviously, the tummy tucks, the repair is a little bit more aggressive than that you do on the C-sections, but the C-sections open your muscles. We don't open your muscles. So because of that, a lot of patients experience less pain with the tummy tuck than with a C-section. Yeah, here's this, see? Ms. Sable says the C-section is worse. Yeah, I mean, I heard that, and I think it has to do with the fact that we don't cut the muscles through. And remember, we use Exparel too. That I don't think they do in many C-sections. So, what's the recovery time for ETT and breast reduction with lift? Always thinking about 1 week per procedure. So those are 2 procedures, 2 weeks to return to normal activity, meaning like driving, office stuff. When you're talking about returning to like this gym or things like that, is 2 months. How many lymphatic massages do you recommend getting? I think we're gonna give you the first 3. A lot of patients add 2 or 3 more while they are here in that week, and we will recommend you to do it for the first 2 months, maybe a packet of 10 more or so. So during the process that you are recovering and getting all that fibrosis softening, that you can have good massages that help with that. Massages have shown to be very important and very critical after body contouring surgery. So I'll definitely recommend it. Packet of 10 is probably a great idea. Let me see if we can show here. Let's see. I do have a question. If you don't want after picture, each page. Here's a question: if they don't want your before and after picture on IG, first of all the pictures that you see that we post is because we had the permission of the patient. We don't post anything that we don't have, and if you don't want your picture posted, it's perfectly fine. Guarantee you we won't post it. We are very, very mindful about patient privacy, and we only post the things that patients allow us to post. How long after incisions? Oh, that's okay. That's the same thing I did here. Oh. How soon can I go to the gym after breast surgery? So usually thinking about 4 to 6 weeks, but you can go crazy. So you kind of have to start slowly and progress. So it's important that you do this in a stepwise fashion. Let's see. Where I did my residency. So I did 2 residencies after I finished medical school. So I studied to do what I do for about 14 years, 6 years of medical school. Then I did 8 years of residency. I did general surgery first and then plastic surgery second. Plastic surgery, I did it at the Mayo Clinic in Rochester, Minnesota. It's a very well-known institution, amazing place actually to train. How do I before and after pictures? For women age 70, how feasible is a mommy makeover? Again, this is a great question because it doesn't have to do with your age. It's had to do with your how healthy you are. So if you're healthy, I don't care. Usually 70. It will be on the advanced age, but if you're very healthy and depending on the procedures that you want have done, then it's still possible. So just send us your consultation. We will look at the picture and see, but it's never too late, Let's see. I believe I have fibrosis or scar tissue after lipo and tummy tuck. What do you recommend? So, a lot of the recommendations in terms of treating the fibrosis, mainly massages. There are therapies added to massages with ultrasound, with cavitation, with carboxy therapy. All these therapies that you can probably find closer to you help to smooth out the fibrosis. You can always let us know, send us pictures if you're a patient of ours, or we will recommend. But I think massages number 1, and I think you look for carboxy therapy, look for cavitation or ultra cavitation where they use ultrasound machines. All this helps break down the fibrosis and smooth out the fibrosis after lipo. Let's see. Chiquinha, see if we can bring, who's here? They want to talk to us. You're truly the best. I had my BBL on 2018 and still looks good. I got pregnant. Hello.
Hi,
How are you?
I'm good.
How can we help you? Do you have any questions?
I was just wondering, like, where are you from?
I'm from Argentina. Do you know where that is?
No.
No? Do you know where South America is? Where are you
Not
from?
Really?
Where are you from?
I'm from America, like Ohio.
Ohio? Girl, you had to go and do some geography then. That would be my advice. So if you North America, right? Then Central America, then South America. So I'm from South America, the southern country in South America, next to Chile. It's called Argentina. You know when they dance tango and eat barbecue? That's where I'm from.
Oh, that's pretty interesting.
Yeah. So go check it out. You should check it out.
Okay.
All right. Thank you for tuning in.
Welcome.
All right. See, for those of you that were wondering where am I from, then she here got an answer for you. So let's see. So she got pregnant last year, but I was extra staff and something from Chicago, I'm sure. Remember. So what is it? Chiquita 89. So she got pregnant after BBL, but she says she still looks good. I think she looks, plastic surgery makes you look good kind of forever. You know, patients sometimes are worried that when they get a plastic surgery and then they get pregnant, they're gonna have, a lot of impact. And a lot of times I always tell them, listen, most patients look great for a very long time, even if they get pregnant. So even patients that had tummy tucks, a lot of times they don't even need another tummy tuck. So if you're not sure, you're considering, don't let that hold you back. I think it's okay, you probably don't need a tummy tuck at 19, but if you are in your 30s and you didn't have a kid, or you're thinking of having but you're not sure, or you have 2 kids and you're sure you're gonna have one more, I think it's perfectly fine to do these procedures.
So we have Ali. Ali, I saw that you just logged in Top Aesthetics. Ali, where are you? You can show
Yes,
your
Ali.
results. You got operated with Dr. Morales.
And she
Kelly, I think it's Cal Ali. It's Cal Ali, I'm afraid, Top Aesthetics. Ali, if you see us, you can join.
Yeah, send us a
I'm
request.
curious because I want to
add
see your results. You got operated like 2 or 3 months ago.
Hey,
Hi.
hola. How are you?
So I had a question. With tummy tuck and BBL, I know that most places, in Florida, they cannot do it together. But is that something you would be able to do in your office?
We'll do it every time. Every day we do that combination. It's very common. It's a very common combination. Remember that the amount of fat that we can transfer is probably a little bit less when we do the combination. But the amount of fat that we can transfer in these cases is usually enough to make a nice difference. So it's definitely worth it because first of all, we give you better waistline when we lipo your back, and second of all, we give you, we can fill in the hip dips or give you better contour. It's an amazing combination, actually.
Yes. Well, I went for a round 1, and I'm really interested in round 2, but I need a tummy tuck.
Well, that's the perfect timing. We have a special going on for 2 procedures for $9,999. So, yeah.
Okay, so I'm going to email you guys because
Absolutely.
I'm interested.
Click the link in our bio or just DM us and we'll send you the link to send us the free consultation.
Okay. Thank you so much.
You're-
I appreciate it.
You're very welcome. Looking forward to see you.
Yes, I'll see you soon.
See you soon. Thank you. So yeah, so that's the best, that's best time. You really, here's Kali Ali. Let's see. Is this unable to join? I don't know why.
Kelly, this is unable because
Yeah.
she had great results.
Oh,
So guys,
For some
again,
reason, it's not letting me add it.
okay, I just want to
into
go over the special again. Remember, we have the special going on
Ali Ali.
of a mommy makeover. It's 2 body procedures of your choice. It's $9,999, and you get 2 awesome procedures by the doctor that of your choice. My favorite is Paladino, but that's just me because he's giving me a free triple BBL and a nose job.
No,
Check
no,
that
no,
out, huh?
no. They need to fund you first.
You need to fund me in the online store.
Yeah.
You guys, listen, just go ahead and buy 1,000 a million bottles to fund my BBL. Look at this thermos bottle, how cool it is. And you can buy 100 million sliders, and then I can get a nose job and a BBL.
Let's bring Princess.
God only knows. Let's please let's show the people how I need a BBL.
Yeah,
Look at this.
guys, please.
You
just-
need to fund me. Go fund me in the online store, topaesthetics.com. You go to the corner on the right. Hello.
Hi,
Hey, Princess, how are you?
I'm good. How are you?
Pretty good.
Good.
So, I seen that you had a special. It was on Dr. Miami's page.
Correct.
So, for years I've been wanting to get one. So I'm so excited. I talked to Nikwa, who is my
Coordinator, yeah.
Yep, and she was just telling me. I sent her pictures of how exactly I want my breasts to look. I'm getting a tummy tuck. I just wanted to show you real quick.
Awesome,
I'm really
yes.
small though. I'm very, very small. I'm only 121, and I'm 5'4". So.
Very good.
And then I wanted a breast lift, but I was looking at a couple of your pictures, and I like the ones that are like real perky
Yeah, yeah.
with a breast implant. So I was wondering, because I have big boobs, is that possible?
Yeah.
How they
Very good. Absolutely. It's absolutely possible. And then
are.
that's okay. So, and then, you should consider using the mesh. The mesh will be a big difference, in terms of the perkiness of your breast and a longer lasting perkiness. You have babies, right?
Yes, I had a daughter, had a C-section. She's
Okay. Very good. Are you gonna have more or not?
No
No.
more.
Very good. Well, your tummy, you can definitely do the mommy makeover. I think you're gonna benefit from doing a tummy tuck. Exactly. All that
Now-
excess skin should go away. Yeah.
Okay, now with the breast, I just really like the look with the implants, the perky look. But would it be possible to remove maybe the fat and get implants, or do you think it just needs a lift?
No. When we do the lift, we'll remove the saggy breast portion on the bottom. So that's what's removed pretty much. And then we put the breast implant. And in your case, because your skin is pretty thin, you can tell because when you grab your tummy and you see your breast, and the skin is stretchy. So you need to lift it. You need to really hold your implants, and the implants will sag, will create some sagging on your skin if you don't do something to prevent that. So, but you can do the internal bra and put implants, and you're gonna look fantastic. Your size is amazing. You really, once you get rid of the tummy excess skin and you get a nice implants with perky breast, it's gonna look amazing. You're a great candidate for this. Yeah.
Yeah, very good candidate.
So I'm going to put my deposit down today, and yeah.
No, that's amazing. You're literally gonna look amazing. You're in a really good BMI, and I think patients that are, in their normal BMIs are the ones that look the best. So yeah.
Okay. So once I get my deposit and stuff going, what exactly do you have to do? I know you have to get MRIs and stuff like that.
We will guide you through the process. Usually about 100 days before your procedure, so maybe like 3.5 months, 4 months before your procedure, we start, sending you an email with the orders that you need to get done and things like that. If it's sooner than that, when we'll do it pretty quickly too. You just need a basic lab work and then a doctor's note. So we'll guide you. It's actually pretty simple. Yeah.
One more thing. My body doesn't really have like this shape, so when I get the look, like the tummy tuck, will
Yeah.
you give me that, or?
Absolutely, and you should consider perhaps doing a BBL. Not because we're gonna make you a big booty, but we can use the little fat that you have because you don't have a lot. But we're gonna use some of the fat to contour your hips and to give you a little bit more of a roundness. And remember that you're gonna be paying 50% off for that procedure that you add. So
Hi, Princess. How are you? We spoke today through the DM.
Oh, yep, we
It was
did.
me.
She's
Yeah.
amazing. I love her energy and everything. I love her.
See?
So
Do you
see-
think he should pay for my BBL and my nose job?
Discount.
let's see how many of those little caps you can get or hats.
I gotta
or-
get a million caps funded.
Yeah.
You guys have to buy all these caps online to pay for my. But listen, no, what I wanted to say while I was listening, I don't want to interrupt because this is a great conversation. You're very beautiful. I was checking your DM today. You're very gorgeous in your face, and that's something that you were born with. So I really think that when you get this surgery and you're skinny, you have a good posture. When you get this surgery done, which take advantage now, you can lock it now and get it further down the line. It's going to enhance your beauty because you are very exotic and very gorgeous.
Yeah.
So I would really take advantage of this.
Excited. Okay, well, thank you guys so much. I appreciate it. I'm gonna take care of it right now.
Yeah, that's awesome. That's awesome. You're gonna look amazing. Yeah. We want a lot of patients like you. That's awesome.
Yeah.
Bye, princess.
Alright.
Thank you for tuning in.
Thank you.
No, it's pretty amazing. You know, a patient like her, typical patient, she's beautiful. She just have the mommy traits, you know, the boobs have dropped because of the baby. The tummy has a little bit of excess skin that you're not gonna get it better with exercise. So that's the main reason why these procedures were designed for. And, you know, they in every patient makes a huge impact and improvement. And when you have a great BMI like she does, you know, it's a very remarkable improvement. You can always add a little bit of fat transfer like she was asking, just to give you a better shape overall to your body and her hips. So it looks, that looks pretty amazing. Let's see, I'm gonna keep trying to add Ali. Let's see if now,
Yeah, because
seems like we are able, no, it's in the, okay, let's see. Hey! Kali, Ellie.
Hi.
Are you at work?
Are you working?
Yeah, I'm at work.
Oh, darn it.
My results.
That's awesome.
It's been 5 months, honestly. Like,
Okay.
I don't know if you guys can see it.
Yeah, we get a little,
Yeah, put the
that's
count.
better.
Look, I love my results. Like,
That's
I wanna
awesome.
go to any other
Wow, that looks really good.
That's
Yeah,
what I
if
say
you
we
can put it.
got. Let's put it like this.
Wow, Ali, that looks really good.
So listen, tummy tuck, and what else do you have done?
I got my boobs done.
Boob jobs. Okay, great.
Wait, let's show it. Let's show it. Hold
It looks
on.
amazing.
Lift up your sweater again so we can see it.
See?
Yeah.
That's what I need too.
And I have a BBL, which
That's another one that I need. Wow.
But I love my results. I wouldn't change this for anything in the world.
No, you look
No,
amazing.
you look amazing.
It really looks.
Listen,
beautiful.
Ali, and Dr. Morales worked on you, right?
Yes.
That's awesome.
Awesome.
That's awesome.
He was really good, really good.
And you did
I love it.
the 3 procedures at the same time, right?
Yes. And I stayed at the hotel, which I love the hotel. It was really nice. The massages were great.
That's awesome.
Good.
Like, I love the massages. They were really, really good.
Ali, you look really good. Your face is shining, girl. This really lifted you up. You look awesome.
Thank you so much for giving me back my life. Like, honestly, I love myself. Like, I love buying new clothes now.
Oh, yay.
And I
That
just
is-
wanted to thank you guys. And I recommend everyone. I think 2 of my friends booked in with you guys. One is in October, and the other one's still booking with you guys.
Amazing.
Awesome.
Amazing.
Well, we're happy to have them here, and you look amazing, and we're really proud of how you look, and your face is shining and stunning from the last time I saw you, Ali.
Yeah.
Amazing. I love it. I love it.
Keep up with the
Thank
follow-ups.
you so much.
Yes.
Thank you so much, but I have to get back to work.
Yes, go. Bye.
Thank you. Bye.
Thank you so much. That's amazing. Yeah, see, she got the 3 procedures done with us at the same time, so it's very common for us to do this combination of procedures. The patient always asks, can you do these 2 procedures or 3 procedures at the same time? And yes, we definitely can, you know. So
Somebody wants to go live. Camila Ramos in La Magic Surgeon. Can I go live to ask you a couple of questions?
yeah, you can just send us a request. If we find you here, let's see if we
Camila
can ask you. But just send us a request and we'll add you right here. Let's see. Numi, 8 weeks before and after post-op, and love my results. Noemi, you can always jump in here, Noemi, if you can, so we can see how you're doing and your results. We'll do the follow-up right here on the live. if you're not very shy. I'm just looking for Camila.
I can show you my pre-operative results.
I don't think.
There it goes, guys. Listen, you know what my mom asked me if she could transfer her fat to me? That's
Yeah.
not possible, right?
It is not.
It's not.
Unfortunately,
Is this a
it's
different
not.
type of blood?
That exactly.
it's
yeah,
because of that.
yeah. This is your
She's
weird.
like, I'll give you my blood. She's 72 and she wants to get a breast reduction and a BBL. But she's in good
Okay.
health.
Good. Well,
Did you do it? I told her,
she
Mom
should send her
said it.
consultation.
You know what she said to me? She said, man, that doctor does such a great job and it's cheaper than Argentina.
Yeah, I'd
And
imagine
I'm like,
that.
that's funny because we're dollars here, over there is pesos.
Yeah, I know.
So people
our
are flying.
prices-
My mom wants to get surgery with Dr. Palayo. I don't know what you guys are waiting, but the mommy makeover, 2 body procedures, $9,999. It's a bargain, you guys. It's now or never.
Definitely should consider. It's a really good price for the combination of procedures. And remember that we have everything, just in one place. All your recovery, you don't have to worry about anything.
Nothing.
Which is
5
which is
minutes
good.
away for the people that were just asking how
Hello
far
from
away.
Liverpool, England.
Oh, wow. Hello there.
Hello there.
Hello there. Is that you? Really? Do you want to dance with me? I love it. I'll just die when somebody talks to me like that. Should I get to BBL? Is that right?
It's amazing.
Listen, guys, $9,999 for a mommy makeover. These are one of the last ones that's flying out there because everything is going up. You were asking how far is a hotel from here, and it's literally 5 minutes away. Of
Yeah.
course, it's 5 minutes away with our driver. I drive in 1 minute because I have road rage, but you're not going to be with me. I'm just interviewing you guys, which, by the way, if you let me interview you, you might get a
see.
little goodie bag at the end of the interview.
See if we can get Camila. She's
Okay,
trying.
let's see,
She
Camila,
said
if you
she
get
wanted
in. I
to.
sent the request already. Yes, to join
Let's
live.
see,
And
let's
she wants
see.
to ask a couple of questions. Feel free to join us if you want to ask questions, show your results. That's awesome, so everybody can see it. If you're proud, if you're happy, if you want to show it. Remember, again, the mommy makeover, $9,999. Oh, somebody's kicked
No,
these in.
no,
Oh,
it's
okay.
just my
So people were saying I didn't get a response yet. You guys, listen. Allow 72 hours. He has to quote you. The coordinator's gonna, it's all like the system is all automatic. So you have to wait until he sees your body, he sees your BMI, he sees what you want to get done. He evaluates that. He sends the quote, which you qualify for the special at the moment. And then the coordinator and you can arrange. But if you don't get any response in 2 or 3 days, please
Yeah.
DM us. You DM me, Magic Surgeon Top Aesthetics, any of the accounts. I will get back to you, if not in an hour, less.
Yeah.
And I will reach out and send you the online. I will check.
Hello, Mitzi. How are you?
Hi, good
Hi.
to see you. Sorry, I'm a mess. I've been a little under the weather.
That's awesome.
Well, I got my BBL and tummy tuck in July of
Hi.
last year,
That's awesome.
and I couldn't be any happier. I love it. I mean, you can't see my pajama.
Let's see.
Wait, am I blocking you?
I good.
Could you see it?
A little bit. Can you lower the camera a bit or not?
Let me hold on. Let me see if I can just open a little bit. Can you see? my
Oh wow,
face?
yeah, amazing, super flat.
It's still flat.
That
I'm
is-
still taking care of myself.
That is amazing. Yeah, I see it. That is pretty amazing.
I mean, it was a great experience, and now I want to just. I have a question. Is there such thing as transfer to the breast?
Yes, you can do fat transfer to. You can, but we need to see your pictures first to see if you're a candidate for that. And then when you send me pictures, it will be great that you send me some wish pics, because that way we can say, hey, I want to look like her. Is it possible to do this with fat transfer? And then we can recommend further if it's okay to do with fat transfer or if it's better to do implants. So if you send us the pictures, just a regular consultation and some wish pics, we can have that conversation and I can tell you I recommend the best, route. But yes, it's possible to do fat transfer to the breast.
Okay. I have another question. Can I start doing it now, being that it's gonna be a year in July?
Yeah, absolutely, because it's a different site. Yes, it's possible. You're closer to a year, more than 6 months, and yes. Okay, we had kicked out from this one because it's been an hour. But so we'll continue to answer your questions. Some patients were here answering questions, or some of the followers were saying if we do boob jobs. Yes, that's what we do. One of the things we do. We do more things than that, but yeah, we do boob implants. People with diabetes, can they do something? Yeah, absolutely. It doesn't matter if you're diabetic, as long as you're under control, you could be a perfect candidate for surgery, not as long as your diabetes is under control. I don't need a tummy tuck, or I don't know if I need a tummy tuck or not. Can you tell me? Yes, of course. Either you jump here in the live and we can see you, which will be the easiest way, or you send us a consultation and then we'll see you. We'll give you our opinion, and that's free. So both things are free. How is Sonia doing after a procedure? Sonia is doing good. Not sure which Sonia you're talking about, but all the Sonias that we've done, they're doing amazing.
Later, I think, 'cause we didn't
Yeah,
really
ask Sonia. Sonia is, is Sonia, our coordinator. She's doing amazing. Let's see.
Camille Ramos, we can't. Like,
Yeah, I tried, but it didn't let
maybe
me.
she has something on her account that is restricted or something.
For some reason, it didn't let me. Okay, perfect. Well, we are getting to this hour, the end of the hour. How much body you need for fat transfer? How much, I guess, fat you need for fat transfer to the breast? Not very many, not very much. We just need, the best thing is that you jump in here and we'll tell you, or you just send us a consultation, free consultation. Okay, let's do one last one and then we will be gone. So we are located in Fort Lauderdale, Florida. This is very close to Miami, in South Florida.
Oh, there you go.
Hello.
Hello, how are you?
I'm good. I'm having surgery with you on Monday.
That's awesome.
Hopefully. My coordinator recommended, well, she said you recommended J plasma and arm lipo as opposed to an arm lift.
Okay.
But my arms are huge.
Yeah, I know. No, actually, yeah. I don't think so you are a massive weight loss patient, right?
Yes.
Okay, so this is the deal. If you're okay having the brachioplasty, we call it, or an arm lift, at some point now or in the future, I think you're gonna be doing better with that. A lot of patients say, okay, let me see if we can do lipo and J plasma. In your case, I believe it's gonna be better just to do the brachioplasty. Now, what procedures are you having done on Monday?
I'm booked for breast lift with implants,
Okay.
tummy tuck, and BBL, but I can go without the BBL. And arms instead.
Well, I mean, sure, but in cases like yours, especially in patients that are massive weight loss patients, I always recommend to do kind of the center portion first. You're adding your breast to that, which is okay. But a lot of times I try to focus on your kind of the tummy tuck section and then the lipo of your back and your BBL. And then
I've had a BBL previously last year.
Okay,
So
okay, perfect.
I really wanted my arms done.
Okay, well then fine.
That's
Then
my main concern.
it's definitely a combination that you should consider doing. So you could switch the BBL for the brachioplasty. I think a arm lift is gonna definitely be better for you. Okay, than the lipo.
Also, how does the BMI work? Because when I initially booked, they told me 32, and then when I did my clearance, they told me 30. I have no.
Yeah.
health
Okay.
issues.
So in general, we say 32 for tummy tucks is what we recommend. But again, remember that this is all depending on fat distribution, not necessarily on the BMI as a only thing. So if you have a lot of fat located like in your tummy, we call it central obesity. We have most of your fat in your tummy, and you're getting
I
it.
have a lot of fat in my tummy.
No.
I had a BBL last year, so.
Okay, but
I think
no.
it's
So
not
different type of fat inside your tummy, not the one that we remove with liposuction. You know what I mean? So if you have like a bulgy belly,
I don't.
okay, well maybe you are a candidate. Do you want to show me, or because we look at your pictures obviously, so your pictures will give you the recommendation. If we recommended for you to have a BMI of 30, is because we maybe thought that at 32 you still have a lot of what we call central obesity or visceral fat, in which case will prevent us from being able to get a very flat tummy, just because we're gonna be, just fighting against that fat, like it's, behaving like a baby, right? So it's inside your tummy pushing out. So when we do the tummy tuck and we're doing the tucking portion, the internal corset, we are squeezing all that fat that you have inside your tummy. So the more fat you have, the more central obesity you have, the worse it is for tummy tucks. That's why I recommend for for the patients who have a little bit of a lower BMI in those cases, especially the patients that have a lot of tummy fat. Some patients have big thighs and the tummy is small. So in those patients, maybe they have a tummy, a BMI of 36 and they're still good candidates for a tummy. But that's why we take it case by case, So if you come in with 32, we recommended 30. We might be a good candidate, but you can't expect to have a super flat tummy just because you have a lot of central fat,
Will I see you at pre-op or just the day
Yeah.
surgery?
Oh, you are welcome to come to pre-op. If you want to do that, you're welcome to come here to the office, which is the day before. And we're happy to see you and talk about this in person.
But you're not there on Sunday, right? Because my surgery is Monday.
Yeah, probably you're right. You're right. So probably I will see you on the day of surgery.
Okay.
Yeah.
All right. Thank you.
You're very welcome. Thank you for tuning in.
Stacey Ochoa.
Those are actually really good questions she brought up. Questions that patients ask all the time. And it's that's why we made the recommendations, not only based on a BMI, it's also based on the fat distribution. How is that BMI related to your particular case? So, well, we are more than an hour here. We're gonna continue to answer questions through DMs like we do all the time. So if you guys are just didn't get to answer your question, just let us know. Remember that we have that special going on, 2 procedures, mommy makeover for $9,999. You can add a third procedure for 50% off the price, the usual price. And we also offer the whole package with the recovery and all that.
And if you don't want to get surgery because you're like, you know what, I'm doing so fine, I don't need anything, you can go and fund me in the online store. Go to topaesthetics.com, buy a lot of these and hats and sweaters, and I'll get this BBL done. And maybe, I'll hit it off with somebody, get married. You never know.
You never know. So
See you next Tuesday.
boys, fund her. See you soon. Adios.